Guys, welcome to my channel. This is the first video and I'll be discussing cases related to first year subjects from various books related to USMLE. So this is the first case. A 40-year-old man presents to the physician's clinic with complaints of epigastric pain. After a thorough workup, the patient is diagnosed with peptic ulcer disease. He is started on medication that inhibits the proton pump of the stomach. So we have to focus on the main points or main words, keywords, which which gives the skeleton of this particular case. The first one is epigastric pain. Epigastric pain refers to indicates any problem in the stomach or the lower esophagus, lower part of esophagus. We all know that the abdomen is divided into various regions, and the epigastric region is one of them, which comprises of the lower part of esophagus, the gastroesophageal sphincter, and the stomach. So the patient is diagnosed with peptic ulcer disease. There may be many causes of peptic ulcer which I will discuss. He is now started on medication that inhibits the proton pump of the stomach. Proton pump. This also we have to focus on, and I will discuss it further. Important keyword was epigastric. The abdomen, as we know, is divided into many regions, which signifies various organs present in that particular region. Epigastric is this, which signifies the lower part of esophagus, the gastroesophageal sphincter, and the stomach. Epigastric pain will refer to this stomach, lower esophageal or gastroesophageal sphincter problems. Second keyword was peptic ulcer disease. Peptic ulcer disease is basically caused due to acid exposure to the mucosal lining of the stomach. It causes an inflammation to the area of the exposed mucosal lining of the stomach. Due to that increased acidity, you must have heard this word a lot. Increased acidity will cause peptic ulcer disease. The causes of this are H. pylori infections, non-steroidal anti-inflammatory drugs, stress or lifestyle. Lifestyle means if you are having a lot of spicy foods, or you are not having food at regular intervals, which causes increased acid production in the stomach. These may cause peptic ulcer disease. Tobacco intake or alcohol intake. Third keyword was proton pump inhibitors. Before learning proton pump inhibitors, I would like to teach you how HCl is formed inside the stomach. HCO3 inside the cells splits to form H plus and HCO3 minus. HCO3 minus moves out of the cell, and chloride ions move inside the cell, which further move into the lumen of the stomach. This H plus is transported into the lumen actively using the H plus K plus ATPase pump. This is known as the proton pump. The inhibitor of this pump can be omeprazole, which is used as a treatment of peptic ulcer diseases. Another treatment of peptic ulcer disease is to neutralize the acid in the stomach, which is done by Digen and Eno. The points in the stomach prone to peptic or gastric ulcers are the gastroesophageal sphincter, the body of the stomach, and the pylorus. Symptoms. If the pain or irritability just after eating, it is termed as a gastric ulcer. If the pain or irritability are a few hours after eating food, the peptic ulcer is termed to be in the intestine, because the food stays in the stomach for about 3 hours before it moves into the intestine, and when it moves into the intestine, the food comes in contact with the exposed mucosa, and this may cause pain in that particular area. To sum up this peptic ulcer disease, it is caused by H. pylori infection, lifestyle or stress, tobacco intake, alcohol intake, and non-steroidal anti-inflammatory drugs. The logic behind the treatment of any peptic ulcer disease is to reduce the number of H plus ions present in the stomach lumen. Which are these drugs? Omeprazole, Digin and Eno. Omeprazole inhibits proton pump. Digin and Eno neutralizes the acid in the stomach. Thank you. I hope you learned something from this video.